What to know about lung cancer? Lung cancer is a condition that causes cells to divide in the lungs uncontrollably. This causes the growth of tumors that reduce a person's ability to breathe. According to the Centers for Disease Control, 218,527 people in the United States received a lung cancer diagnosis in 2015. Early diagnosis can help a person seek treatment, as early as possible, in the disease's course. Identifying lung cancer in its earliest stages can be difficult, however, because the symptoms may be similar to those of a respiratory infection, or there may be no symptoms at all. In this article, we explain the nature of lung cancer, how to recognize the symptoms, and the ways doctors treat lung cancer before it becomes life-threatening. What is lung cancer? Cancer causes certain mutations in otherwise healthy cells. Typically, the body programs cells to die at a certain stage in their life cycle to avoid overgrowth. Cancer overrides this instruction, causing cells to grow and multiply when they should not. The overgrowth of cells leads to the development of tumors and the harmful effects of cancer. In lung cancer, this pattern of cell overgrowth occurs in the lungs, which are vital organs for breathing and gas exchange. Doctors typically diagnose two lung cancer types, small cell and non-small cell, depending on how they appear under a microscope. A person is more likely to have non-small cell lung cancer than small cell. While anyone can develop lung cancer, cigarette smoking and exposure to smoke can increase the likelihood that a person will experience the condition. Lung cancer can develop if a person has a history of exposure to inhaled chemicals or other toxins. Symptoms. In people with lung cancer, symptoms do not always occur until the condition has reached a later stage. However, some people may notice symptoms, which they may think are related to a less serious, acute illness. Examples of these symptoms include appetite loss, changes to a person's voice, such as hoarseness, frequent chest infections, such as bronchitis or pneumonia, lingering cough that may start to get worse, shortness of breath, unexplained headaches. Diagnosis. If a doctor identifies a suspicious lesion on a lung cancer screening, or a person is experiencing symptoms that could indicate lung cancer, several diagnostic tests are available to confirm the next steps. Examples of these include imaging studies, computed tomography, CT, and positron emission tomography, PET, scans might reveal areas of lung tissue with cancer. Bone scans can also indicate cancerous growths. Doctors may also use these scans to track the progress of treatment or to ensure cancer has not returned, following a course of treatment. Tissue sampling. If a doctor identifies a suspicious lesion on an imaging study, they may recommend taking a sample of lung tissue to test for potentially cancerous cells. The importance of early diagnosis. Early diagnosis of lung cancer can be life-saving. This is because lung cancer cells can travel to other areas of the body before a doctor detects them in the lungs. If this spread or metastasis has taken place, it makes treating the disease much more difficult. Staging. The staging of cancer indicates how far it has spread through the body and its severity. This classification helps clinicians support and direct treatment for the best results. Each stage determines whether cancer has or has not spread or has spread to nearby lymph nodes. It may also take into account the number and size of the tumors. The lymph nodes are part of the lymphatic system, which connects to the rest of the body. If cancer reaches these, it can metastasize, or spread further, becoming more dangerous. Staging for lung cancer is extremely complex and extensive, with several subgroups within each stage. Treatment. Treatments for lung cancer depend on its location and stage, as well as the overall health of the individual. Surgery and radiation are the most common approaches to treating lung cancer, but other treatments are available. For example, doctors often treat small cell lung cancer with chemotherapy. Possible treatments include surgery. A doctor may operate to remove cancerous lung tissue and tissue in the surrounding areas where cancer may have spread. This sometimes involves removing a lobe or large segment of the lung in a procedure called a lobectomy. In severe cases, the surgeon may remove a lung in its entirety. A person can live without a lung, but being in good health prior to surgery helps to improve outcomes after lung removal. Chemotherapy. This treatment uses drugs to shrink or eradicate cancer cells. These medications target rapidly dividing cells, which makes them ideal for treating cancer. Chemotherapy treatment has a more significant impact on cancers that have spread to different parts of the body and require a body-wide attack. However, chemotherapy is a powerful intervention and can have side effects including extreme nausea and weight loss. Radiation therapy. This approach uses high-energy rays to kill cancerous cells. A doctor may also use radiation to shrink a tumor before removing it surgically. Radiation therapy is mainly useful on cancers that occur in one location and have not spread. Targeted therapy. This is the use of particular medications that specifically target a particular behavior in cancer cells. Examples include medicines that stop cancer cells from multiplying. Takeaway. Lung cancer is a serious and potentially deadly disease that affects a person's ability to breathe. However, early diagnostic screening of individuals who are at high risk for lung cancer can help them receive treatment in earlier and more treatable stages. The size and spread of cancer determine people's outlook. Treatment options include surgery to remove sections or all of the lung, chemotherapy, and radiation therapy, as well as targeted drug therapy.